Hello and welcome. I'm Bob Cusack, Editor-in-Chief of The Hill. Thank you for joining us for Diabetes Technology, Disparities, Access, and Equity. We will be exploring how disparities in diabetes caregiving and technology access impact vulnerable communities amid evolving population demographics. Before we begin, I'd like to thank our sponsor, the Diabetes Leadership Council, for its support of today's event. I'd also like to take a moment to thank my colleague, Julia Manchester, for joining me today to facilitate these important discussions. Improvements in personal diabetes management continue to enhance the quality of life for millions of Americans. However, innovations in technologies like insulin pumps and continuous glucose monitors are not equitably accessible. With some studies suggesting the diabetes technology disparity gap has widened for American children in recent years, how is the medical community making these essential tools available for everyone? How can leaders in Congress and the administration prioritize equitable advancements in care? And how can bias be eliminated throughout the healthcare ecosystem? We are going to be putting these questions and more in front of our fantastic speakers. But first, a few housekeeping notes. You can tweet us at the Hill Events using the hashtag #TheHillDiabetes. We are broadcasting live and we'll be taking your questions throughout the program. As with any live stream, you could experience occasional trouble with the video. Refreshing the page should, in most cases, fix the problem. My first guest is Chiquita Brooks-LaSure, Administrator for the Centers for Medicare and Medicaid Services. She oversees not only Medicare and Medicaid, but also the Children's Health Insurance Program and the Health Insurance Marketplace. Welcome, Administrator Brooks-LaSure.
Thank you. It's great to be with you today.
I'm dating myself, but I actually started my career in Washington covering HCFA, which was CMS. It was called the Healthcare Financing Administration. CMS is a much better name. Let's start off with what CMS is doing. I know you have a Medicare diabetes prevention program. Can you tell us a little bit about that?
Certainly. And I first want to start with just talking about how much diabetes is such a critical an area of focus for CMS. We recently outlined our 6 pillars, and our first pillar is focused on health equity. And when I talk about health equity across the agency, I really think about us embedding it in every part of what I call the 3 M's: Medicare, Medicaid, and CHIP, and marketplace coverage. And when we look at diabetes, it is a condition that disproportionately affects communities of color and is one of the most one of the top costly illnesses for us as a country. So it's so important that we tackle this issue, and I'm so pleased that you are having a conference on this topic. So you asked specifically about the Medicare Diabetes Prevention Program. That is a program that is a demonstration that CMS has been running, that a lot of the people who participate in are very pleased with the efforts. And so one of the things that we announced this week is that we are trying to improve the model to increase access to services for people with Medicare in rural areas, and really try to decrease the number of individuals with diabetes in both rural and urban communities. One of our areas of focus here are really the ability to make sure that people living with diabetes are able to pay for their medications, creating programs that teach people living with diabetes about their treatment options, how the healthcare system works, and the value of adhering to their treatment protocols and everything that comes along with managing a chronic illness, and ensuring access to care through multiple channels. So one of our areas of focus at CMS is making sure that we're getting everyone who's eligible for coverage enrolled and making sure they have access to the care they need when they are enrolled in coverage. And finally, I would say our approach is really trying to develop programs that people trust so that they want to make sure that they're adhering to the things they need to do to manage their disease.
We've been taking questions, as I mentioned earlier, and I do have a question for you from our audience. It's from Julia Kenny, and she's a senior associate at the Diatribe Foundation in San Francisco. Her question is, how can we increase access to continuous glucose monitors for people with diabetes on Medicaid?
Such an important question. I think that our Medicaid program is vital. We have 80 million people enrolled in Medicaid and CHIP right now, and because of the efforts of so many states, and many of the people with diabetes are covered through those programs. As you know, Medicaid is jointly run by both us and states, and so a big part of the need to continue to make sure people have access to care is really working with states to make sure that they are covering the products and the treatments that people need, and also letting us know at CMS when there are access issues. So one of the things that we are thinking about as an agency is how we should and can strengthen the Medicaid requirements to access at the federal level to make sure all Medicaid beneficiaries, enrollees are getting access to care.
From a big picture, why are the disparities so persistent in technology access? And what can policymakers do, whether that's you and Congress, to really help that situation?
Well, I would say that, as we know, there are disparities in our healthcare system, and that is something this administration is really focused on tackling head on. There are a variety of issues around why we have access issues, and particularly about technology. There continue to always be the back and forth about when is technology appropriate, and how do we cover the products that are so crucial for people to get access to care, at the same time manage fiscal pressures and constraints and realities. And so I think that one of the things we're continuing to do at CMS is trying to make sure that our programs are covering the innovative products that work, that really make it easier for people to have access to care. Of course, there are times when we need Congress to give us more authority, and we have limitations. And so that's, of course, when stakeholders go to Congress and ask or require CMS to take additional steps. But I think some of our larger issues, again, of making sure people have access and knowledge about what they have access to. So sometimes it's a question of things being covered, but does everyone have access to the mechanisms that make sure your benefits are covered in the way that the law intends?
You mentioned the Biden administration, which you were serving under. COVID-19, obviously a major focus of this administration. COVID-19 is deadlier with people with diabetes. Can you talk a little bit about that and the urgency of coming up with solutions and education, as you mentioned?
We have seen, as you said, that people with chronic conditions such as diabetes are much more likely to have poor outcomes because of the pandemic. I think one of the most important things that people can do is get vaccinated. We are, as you probably know, today announcing our requirement that healthcare facilities that are certified by Medicare and Medicaid make sure that their workers, their staff are vaccinated. And I think that's one of our key priorities in terms of getting out of the pandemic. I would say that we have learned, hopefully, as a society and certainly as policymakers, so many lessons during COVID-19 that we need to take into our healthcare system moving forward. So people with underlying conditions have worse outcomes, and that's because we need to make sure that we're getting people preventive services, that we are managing these conditions, and making sure that we are addressing not just what we think of as the acute need, going to the hospital, the asthma attack, whatever, the diabetes when it progresses to such a unfortunate a place where we're leading to amputation and other worse outcomes, we need to make sure that we are getting and managing these chronic conditions upstream so that we don't get to these more serious complications.
Now, you've recently wrapped up your first 100 days as the CMS administrator, and for our viewers who may not be familiar with CMS, it is a big government agency, deals a huge payer, billions of dollars, hundreds of billions of dollars over the years, of paying to providers, dealing with Congress, making coverage decisions. How's the first 100 days gone? It must be a pretty intense job.
It is, but it is the privilege of a lifetime. I just am so thrilled to be in this role, especially at such a critical moment when we have such an opportunity to really change how our healthcare is being delivered. I truly believe that. I was a part of the passage of the Affordable Care Act, and that was born out of people really suffering because of the Great Recession and medical bankruptcies. And I think we saw how important it was for people with pre-existing conditions to no longer be restricted from getting health insurance. And I think we're in a similar moment where there is such a focus on addressing our disparities in our systems. We have more ability than ever to move the healthcare system in a better way. And so there's no greater place to be than in over an agency that has responsible for these 144 million lives. And we need to make sure that we are operating in a way that delivers care better for the American people.
It is definitely one of the most important jobs in the federal government, especially in healthcare. Thank you so much, Administrator, for joining us today.
Thank you. Have a good rest of your conference.